Welcome to Veterans Health Watch. With more than 53,000 veterans actively using the VA Maryland healthcare system, we realize that some family members may have to step up as caregivers. That can be a daunting task. But the VA is here to help them, the caregiver, and our veterans. And here to tell us about her story as a caregiver to her parents is Belinda Edwards. Belinda, thank you so much for joining us.
Hi, Kenya. Thank you so much for allowing me this opportunity to share our story. As you said, I'm Belinda. I care for both my parents. My father is a veteran. I actually reached out to the VA to understand what opportunities he had available to him, and more importantly, how they could assist me in caring for my father during his time of need.
And tell me about some of the signs that you noticed that it made you think, you know what, I need to step in here as a caregiver.
So it started with an increase in doctor's appointments. And then I started noticing that mail was piling up a little bit. And when I would ask them, had they looked at the mail, were the bills okay? My parents would say, yes, we think so. But then I started going through the mail and I thought it was time to step in. I can't say that my parents were initially welcoming of this activity, but over time now, my father just asked, is this paid? And I'll say yes, and he'll say okay, and that's the end of the conversation. And we've become somewhat of partners, and as far as me attending his doctor's appointments, and then I come back and fill in my mother as well. So it's the three of us trying to care for each other.
Yeah, and you mentioned it sounds like your parents are mobile, and I think usually some people think of a caregiver is needed for people who aren't able to get around on their own. What kind? But it sounds like a different situation for your parents. What kind of other things do you do for them as a caregiver?
So as their caregiver, I also help them with their groceries at times. And yes, you are right. My parents are mobile, but there are some memory issues. So I feel it necessary to jump in now instead of wait until later. I've also actually documented their assets because there will be a point in time where we may need Medicaid services. I need to have that information. So I try to talk to my parents now while I have the opportunity to do so. This is actually where the VA has come in because the VA reaching out to the social worker actually got in touch with, had me get in touch, excuse me, with the caregivers group. And that has been a godsend as far as the topics that have been discussed. It has changed my view of the situation. I always felt that it is my job, but it's not a job to take care of my parents. They were there for me, so I need to take care of them. The only way I can do that in the right way is to become knowledgeable. And so that's where the VA came in to help me.
But speaking of the VA coming in to help you, Hillary, as a caregiver support coordinator, and your experiences are Belinda's experiences typical?
I really shy away from the idea of there being a typical caregiving experience because our caregivers are just as varied as our veterans. And so, caregiving comes in different ways for different folks. And so, we certainly see children of veterans stepping up to become caregivers. We see spouses, we see close family friends, we see neighbors, we see former coworkers. So for me, I think for the caregiver support program, we shy away from the idea of this is what caregiving is supposed to look like, because caregiving is supposed to look like whatever that family, whatever that veteran and that caregiver need. It's about finding a way to meet the needs of the veteran while still meeting your own needs, while still taking care of yourself, um, and finding ways to navigate challenging situations.
Tell us more about the caregiver support program, some of the services you do offer to people like Belinda.
Sure. So we have two parts, kind of two programs in one in the caregiver support program. We have our program of comprehensive assistance for family caregivers, or PCAFC. That's one of the programs that's recently expanded. So folks may have seen some information about that out there. prior to last October, that program was only available to veterans who were seriously injured on or after September 11th, 2001. What's happened since then is that this past October, we expanded to also serve veterans of the Vietnam War era and prior. Our program of comprehensive assistance for family caregivers does have quite a bit of regulation around who's eligible for that program, as well as a pretty significant application and assessment process. But through all of that, we are able to offer eligible family caregivers a stipend to help offset the cost of their caregiving services. Now, not everyone is going to be eligible for that side of our program. So we also have our program of general caregiver support services that is open to veterans of all war eras. There is no eligibility or assessment criteria. And through that program, we really drive the majority of the educational and support services that we have available to caregivers. It includes classes, it includes support groups. There's even a program called Annie text messaging, which just allows caregivers to get 3 supportive text messages a week. It might remind them to engage in some self-care to help take care of themselves. It might kind of prompt them to think about something that they need to do for the individual that they're caring for. But we offer a wide range of services, both individually and in groups. Some things are virtual, some things are on paper. So there's something for everyone.
Belinda, I would love to hear more about how the programs Hillary described have helped you, or what else have you participated in, and how they've helped you as a caregiver, and then how's that translated to helping your parents?
So I actually participate in the caregivers group that is held bi-weekly on Fridays. And then right now I'm actually in a class that helps to educate us as caregivers. So I've been very fortunate, and in turn, what has occurred, how I apply the education that I received is, again, how I speak and understand my parents, as well as reaching out to other community associations that will offer care, offer support, provide services.
I would think as a daughter, you've seen your parents for years. You know, you saw them young and strong, and then the roles are reversed, and you're supporting them. What have you learned through the caregiver support program to kind of help you with your perception of your new role?
That I am enough and that I am doing the best I can with this current situation. And that's helped a lot, especially because there are times when it's just overwhelming. So I don't want to say that I don't want to sugarcoat this. There are times when we struggle and there are challenges, but we're still here. We're still thriving. We're still here to support each other. And I also hope that we can support the community through sharing our story and continuing our relationship with the VA. I cannot thank you enough.
But Hillary, when you hear something like this, tell me more about why this program is so important.
Caregivers are really one of the most essential parts of a veteran's treatment team. And right now, there's a push with the VA and the Elizabeth Dole Foundation for something called the Campaign for Inclusive Care, which is to encourage our providers to really amplify the role of the caregiver as part of the treatment team. The VA is never going to be able to be everything for a veteran, right? There are always going to be limitations there. And that's where the caregiver comes in. The caregiver is the person who is seeing that veteran on a daily basis, is really the expert in what they need as the caregiver, and then, what the veteran might need. And I am just so humbled to be able to be a part of that team, a part of the team that supports the caregiver in their role, the ability to just offer the reassurance and acknowledgement that we see you. We see, the Elizabeth Dole Foundation often refers to caregivers as hidden heroes. And I think that that's so true, right? That we don't see them. Caregivers are sometimes, the ones who are in the background, making sure that everything keeps moving for that veteran. And so sometimes one of the most powerful things that we can do for our caregivers is to say, we see you and we hear you and we see the work that you're doing.
And what kind of veteran would need a caregiver or qualify for this program? It just hearing Belinda's story and knowing that people may be there, and some veterans may be a little shy or a little into self-reliant and independent. What veterans need this program or would qualify?
So for our general caregiver support program, veterans of all eras qualify. You do have to be enrolled in VA healthcare, but if your loved one, if your veteran is not enrolled yet, that's certainly something that the caregiver support program has and can help you navigate. Who needs a caregiver? That is really dependent on the person. It's about if there is an individual who needs assistance meeting their needs and achieving their health and well-being goals, and they have another person who helps them to do that, that person is a caregiver, right? And so it's not always as kind of clear as someone who is unable to cook their own meals or change their own clothes and needs physical assistance doing that. Sometimes it's someone who needs help navigating their doctor's appointments or can't remember their medication and needs reminders for that, or someone who may be struggling with their mental health and requires supervision to ensure that they're safe on a daily basis. And that's why I like to say there's no typical veteran and there's no typical caregiver.
So how can a person learn more about the eligibility requirements?
Sure, that's a great question. So there are a couple of really key ways that folks can get in touch with us. One is there is a national caregiver support line. That phone number is 1-855-260-3274. The caregiver support line is available. There are licensed social workers who answer those calls. They're able to not only help address situations in the moment, but also to connect caregivers to their local caregiver support program. So anyone nationwide can use the caregiver support line, and that line can help get them connected to their local program. Another great option is to check out the caregiver website, which is caregiver.va.gov. That website has tons of resources for caregivers, information about our programs, but also information about specific needs that caregivers might have, disease and illness specific information in terms of who they're caring for, as well as all of the information about the eligibility for our programs. And then just one last phone number is our local caregiver support office. So folks can also contact us directly. That's 410-605-7000. And then our extension is 54143.
Belinda, what would you say to people in the same circumstance that you were in?
So first and foremost, I would ask them if their parent is a veteran to check out the options for the VA. That's the first thing. Also, talk to their community Department of Aging. And then if there's any other hospitals or any community services that support our elderly, to reach out to them as well. That is the trifecta of support that I have right now. And I'll be honest, I share what I learned because I have a lot of friends that are in the same boat as myself. So I try each one, teach one, and that's what I try to do.
Thank you so much. Thank you, Belinda, for sharing your story, and Hillary for what you do for our veterans and our caregivers. This was a great topic to review for everyone.
He was in a medically induced coma for 3 days. To see your hero laying there was like unbearable. I became his caregiver. It was now, okay, check the calendar and see how many appointments we have throughout the week. I had to be very diligent about making sure that I didn't run out of the medication that he was required to take. When you have a 52-mile round trip, you just can't run down to the drugstore down the street and get it filled. So when my husband's doctor recommended a different avenue that we could take, we decided that we could give it a chance. With the video appointments, I'm right there with him and his doctor, and I feel like I'm a very big part of the appointment. I can sometimes point out things that he is not following up on that to me could hinder his well-being. We can be anywhere we want to be and still have the doctors readily accessible to him. With My Healthy Vet, he can order his own prescriptions, he can monitor his appointments. That frees me up to do other things. I think sometimes we tend to forget how much is put on a caregiver. You take care of others, but you always put yourself last. I have no doubt that he's getting the same, if not even better care through the telesystem. I mean, that's the key word, is health. It's made my husband healthier and even myself and our marriage.
Hi, I'm Dale. I'm a veteran here at Perry Point, and I'm in grounds, and I love taking care of the campers for all the veterans out there.
There are roughly 2 million women veterans, making up 10% of the veteran population and growing. Yet some women still face challenges accessing healthcare or being recognized. To address this concern, the VA Maryland healthcare system is participating in the I Am Not Invisible project. And here to tell us more about it is Zelda McCormick, Special Population Program Manager for the region of our VA. Zelda, this sounds like an exciting project. Tell us more about it.
It is exciting, and I'm thrilled that the Maryland healthcare system was supportive in my desire to participate in this campaign. So the whole project aims to increase awareness and dialogue about women veterans, their contributions to the military, and just to raise awareness that the needs and the experiences are sometimes very different from men who have also served in the military.
And your experience with women as a women's program manager at one point, why is this project so important?
Well, it's important to me because outreach was a huge part of my role as program manager. And oftentimes when I would ask, how many veterans do we have, in the room? A few hands would go up. So this is a room of women. A few hands would go up. But then when I asked, how many of you have served in the military, then more hands would go up. So this confirms that a lot of women don't self-identify as veterans. Many of them think that if they didn't serve in combat, that they're not considered a veteran. So if they don't always identify with the term, then a lot of everyone else probably does not always make that connection. So I thought it was very important for us to take advantage of this opportunity so that there is a visual that shows all of the women, the different nationalities, the difference in the age groups, of women who are serving. And the photos even tell you a little bit of the background. So the women veteran population it's like the world. It's very diverse. We don't all look the same. We don't have the same backgrounds. We don't have the same experiences. And this was something that I thought would be really nice to engage passersby to be able to see what our women have contributed.
And I think you kind of answered my next question. How did you go about selecting the photos from so many women to participate in the project?
So there was a photo bank that we could select the photos from. And my goal was to identify photos that demonstrated diversity. So when you look at the photos, you'll see different branches of the military being represented, different races, different age groups. I believe that the photo bank had great options to choose from, and I just wanted our display to be reflective of that.
And you've been with the VA for a while, and you've seen so many changes. And you talked about being in a room of women veterans, and some of them didn't identify as a veteran. How have you seen times change for healthcare for women over the years? So
I started in the VA in 1992. So back then, it was a huge deal to have a female on the unit. So, in report, if we were told that there's a female patient, everybody wanted to meet her. Like, it was a big deal. Now things have changed such that, it's more common to see women. We see women of all ages. At one time, we never saw young women. So now we're seeing young women. We are seeing them pushing strollers in the hallway. Well, before COVID. We could hear babies crying. So things have significantly changed. And as an organization, the Maryland healthcare system has truly adapted to the changes. We have baby changing tables in the bathrooms because the men and the women sometimes bring their babies to the appointments. We have separate spaces for women because even though women are the fastest growing segment in VA, they are still by far the minority. So it can be uncomfortable for a handful of women to be in a waiting room that's full of men. So we do have separate spaces for the women to wait for their appointments. We have 19 comprehensive women's healthcare providers. So those are your primary care providers who not only provide the primary care part of the healthcare, but they do the gender specific part as well. So women can get their pap smears, their clinical breast exams, talk about menopause, family planning, all of that gender specific stuff can be, that conversation can take place with their primary care provider, all in one visit. So we've done a lot to adapt to the need to be welcoming to women and to be competent to take care of them. There's trainings that go on several times per year for the providers to maintain competence. because presentations can differ with gender. So we want our staff to be aware of that and to know how to respond.
And you mentioned the staff being aware and educating them. And then you also mentioned that the medical centers are predominantly filled with men, male veterans. What is the VA Maryland healthcare system doing to bring those men along in this cultural shift, really? They're seeing women, they're seeing babies.
They are. And so, as an organization, we are encouraging everyone, the patients, the staff, to be mindful of this change in culture and to be respectful. We don't encourage language that can be offensive. Sometimes a compliment to one person can be very offensive to another person. So, we're just trying to raise awareness about things like that so that the environment can be welcoming to everyone.
When we talk about the environment that's different at the VA Maryland healthcare system, so for a woman veteran who may not be using VA services, what would she see different in a VA medical center compared to just going out in the community to a provider?
Well, I think the main thing is what I touched on before. The comprehensive women's health providers are one thing. I know personally, my primary care provider and my GYN provider are two different people. So in the VA, women can come and have their appointments with a comprehensive provider and get all of that taken care of in one visit. In the Maryland healthcare system, we have on-site mammography. Not all VAs have that. So women can get their 3D mammograms. We have on-site GYN. All VAs don't have GYN on site. So, we're doing a lot to ramp up the healthcare because we recognize the needs of women. And those needs are a priority. And our leadership is very engaged in supporting the needs and making sure that women have access to the services that are needed.
Zelda, this sounds so exciting for our women veterans, for our male veterans, for everyone. Thank you for joining us. Tell us where, before we wrap up, tell us where can people see the display?
So the display is in the hallway that leads to the cafeteria. It's in the hallway on the side where the auditorium is.
Well, we encourage anyone, when you go to the Baltimore VA Medical Center, please check out the display and encourage our female veterans.
Remembering everything you need to do after your VA appointment can be overwhelming. That's why the VA has developed a new tool to help you keep track. Meet Annie. Annie is an automated messaging app that uses instructions from your doctor to help you stick to your personalized care plan between appointments. Annie sends reminders and other helpful messages directly to your phone or other devices. Respond to Annie with a simple text or through the Annie app. Your responses are available for you and your VA care team to review at any time to track your health goals, encouraging you to take an active role in managing your health. Remember, Annie helps you record your health, but is not a way to message your doctor. If you need to send a secure message to your VA care team, please continue using My Healthy Vet. Talk to your provider today to see how you can use Annie in your care plan. To learn more, visit the Annie App for Veterans page in the VA App Store.
Hi, I'm a veteran on the Perry Point campus and I work in IT and I'm on the team.
I choose VA for healthcare because they are sincere and compassionate. VA understands veterans and they provide more services with veterans in mind. I'm a veteran and I choose VA.
This wraps up this edition of Veterans Health Watch. If you're a veteran, apply for VA healthcare today. You deserve it. Just visit our webpage for more information.